pleased to present AB907, which requires a healthcare service plan contract or health insurance policy issued, amended, or renewed on or after January 1st, 2024 to provide coverage for treatment of pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, or PANDAS, pediatric acute onset neuropsychiatric syndrome, or PANS, prescribed or ordered by a provider. PANDAS and PANS are inflammatory diseases of the brain that result in sudden onset, devastating behavioral and neurological dysfunction that usually occur after a triggering infection. These disorders are thought to be caused by autoantibodies generated after the infection that mistakenly attack the brain. Antibiotics and oral anti-inflammatory medication help most children, but a minority need stronger immune modulating treatments such as intravenous immunoglobulin, or IVIg. I always screw that up, sorry. Despite published PANDAS and PANS treatment guidelines that established the standard of care in 2017, 6 years ago, insurers have continued to adhere to their own policy statements, forbidding authorization of immune-focused treatments like IVIg. And as a result, treatments are routinely denied without routine consideration. When a prescriber or a family appeals, insurers typically uphold their denial, claiming, quote, a lack of medical necessity, or that, quote, the treatment is experimental. Unfortunately, most reviewers working for insurers lack experience in this complex, uncommon, and devastating disorder. A typical delay in receiving IVIg due to insurance denials is usually measured in months, if not years. Meanwhile, most PANS and PANDAS sufferers cannot attend school or require intensive academic accommodations, such as home hospital school. They may be hospitalized medically or psychiatrically, resulting in more cost and unnecessary suffering. As a result of delays in treatment, individuals suffering from PANS and PANDAS may accumulate permanent neurological damage. Their parents are often unable to work and may require state unemployment or family medical leave benefits. Children lucky enough to have parents with the financial wherewithal to pay out of pocket or the savvy and persistence necessary to battle the protracted appeals process typically recover well with the appropriate treatment. Yet families who lack these resources often endure financial ruin, possible child abuse allegations, police quote-unquote wellness checks that go awry, and even suicides. This last tragic fact has led to the establishment of the Pond Brain Bank at Georgetown University, where the brains of 3 deceased young PANDAS and PANS patients are now contributing to scientific knowledge. Community physicians are often reluctant to treat this disorder due to its intensity, its complexity, its relative rarity. With the added burden of lengthy insurance appeals, the pool of willing treating physicians shrinks even further. In addition, insurers often restrict and delay access to out-of-network specialists with experience and expertise in this illness. This bill seeks to alleviate these barriers by directing insurers to follow treatment guidance put forth by university-level multi-specialty experts in the field. As indicated in the CHBRP analysis and reflected in the committee analysis, the increase to total net annual expenditures, if AB907 were enacted, is relatively low, constituting a 0.002 increase for enrollees with DMHC regulated plans. With regard to the conclusion in the CHBRP analysis that the evidence of the efficacy of treatments is insufficient or inconclusive, I will say the following. We are fortunate that PANDAS and PANS are relatively rare. However, that means that there are not many individuals who will require the treatments that are commonly prescribed for these disorders. And unfortunately, that means that the sample sizes are very small. And as a result, there is not much data available on the efficacy of the commonly prescribed treatments. But that does not mean the treatments are ineffective. Additionally, and perhaps most importantly, because this is usually a pediatric diagnosis. There is not the same drug or treatment trial data available as there typically would be for adults. This, combined with the limited occurrence or rarity of these disorders, make it difficult to provide conclusive evidence. However, from the perspective of the pediatricians and physicians who are treating kids with PANDAS and PANS, the treatments are extremely effective, and the earlier they receive treatment, the better the outcome for these patients. Early and expedient access to the treatment is crucial to the effective treatment of PANDAS and PANS in order to avoid the debilitating symptoms, potentially permanent neurological damage, and sometimes fatal outcomes associated with these disorders. AB907 will ensure that individuals and families who are confronted with these disorders do not experience unnecessary delays in treatment that can lead to disastrous and tragic outcomes. I am very pleased to be joined by